In Cheshire and Merseyside we have a no suicide strategy. We want to get it to zero. We feel that there are things that can help people prevent taking their own lives. So as part of the Cheshire and Merseyside Zero strategy, one of the main elements is that we wanted to do some gatekeeper training for frontline people, because every day people come into contact with people, for example taxi drivers, barbers, and we don't always know that somebody's in distress. Really, when somebody's in distress, they need somebody to speak to them, have a conversation, and hopefully give them the help and support that they need.
We think we've made a really positive impact. So through the evaluations that we've done, we've received case studies from people that have had the training, where they've fed back and said that actually they've had conversations with clients who they've identified as being vulnerable. And actually, because of the training, they've had the knowledge, they've asked the questions, and they've been able to signpost people to services and get them the required support. In that respect, we know the training's had a really positive impact.
So the fire appliance that you see behind us right across Merseyside on a daily basis. And on a daily basis, these fire engines are out on the front foot in our communities, and some really vulnerable communities. As we go into people's homes, we go to people's businesses to make them safe. We also respond operationally, and what a great advert for the Zero Suicide Alliance. Our role as firefighters is to keep people safe from fires, of course it is, but we expand that role and we want to keep people healthy and well and alive. So it's right that we concern ourselves with broader public health priorities, particularly around mental health and suicide. And our crews are taught how to deal with those people who might be in a particular crisis at that time. They're also given information as to which agency might wish to engage with that particular person to assist them, so we can keep people in a safe place should they be suicidal or in crisis at a particular time.
I think from a mental health trust point of view, it's important that we are actively involved and that we follow the guidance that's set out from a strategic point of view from the national policy, more locally the regional policy, and working and being part of that zero suicide ambition that the regional strategy entails, but also being visible as well from a local point of view and within our localities of the three areas that our trust covers. With all the three mental health trusts in the region, ourselves, North West Boroughs and Merseycare, all being part of the Champs Public Health Collaborative working around suicide prevention, we need to continue the good work that's been done so far from a shared learning approach that we have with the other organisations.
Unfortunately, St Helens was the highest suicide rate for males in the country, and as a foundation and for the Rugby League Club, we wanted to help make a difference to the people of the town and the community. So we run programmes such as back into work and education programmes for ex-veterans and service people. We run fitness programmes for over 35s, a programme called Back On Side, inactive males. We do a lot of mental health workshops, some are done online, some are based here at the stadium. So there's a range of programmes that we deliver all to the people of the community, but it's all based on consultation and need.
Street Triage is a partnership resource with mental health services working with emergency services to get people assistance when they need it in a mental health crisis. So it could be anything from a suicidal crisis through to someone being psychotically unwell, dementia, organic illness, and a range of vulnerabilities. And what Street Triage does, it responds to that need. Some of the mental health crisis doesn't always need a cop. In fact, very rarely needs a cop to support them. What they really want is someone from either a clinical background or someone who better understands their needs to give them the assistance that they require. What Street Triage allows us to do from a policing point of view is get that person early help with clinicians. So it's allowing us to get people who previously we would have struggled to get them assistance at an early stage onto a pathway very, very quickly.
So I think there's a huge stigma around men and men's mental health at the minute, and I think as a charity and as a sport we've got a real opportunity to actually support a lot of these men, particularly living in deprived communities. For a lot of men who live in our towns, rugby league's an identity to them, so they may not go and speak about the mental health to the GP, to the crisis support team, to the mental health practitioner, whoever it might be, but they will come and speak to us, and they'll go and speak to the heroes and the role models because there's a St Helens badge on it or a Warrington Wolves badge or whatever it might be. And if they can actually associate their mental health with something positive, like going to the stadium, like seeing the teammates, like whatever it might be, then actually that's a real opportunity to pull pull them in to speak about a topic they otherwise probably wouldn't speak about. And actually, a lot of the men come to us and say, you know, they came in the first place because it was an opportunity to speak about rugby league and to listen to the heroes, to listen to the role models, who are some of the toughest blokes on the planet and play probably the toughest sport in the world. If they can speak about the mental health, then actually so can everyone.